Okay. Hello, everyone. Good morning, good afternoon, or good evening, depending on where you are in the world. Welcome to TMF Week 20, 2025, and it is the last session of our TMF Essentials 101 themed day. So I hope that you guys enjoyed the sessions that came before our wonderful panel today. I just want to make sure that you guys can hear me and see me. So if you can please put in the chat where you are dialing in from around the world, let me know in the chat very quickly. Or maybe you could tell us what your favorite hot beverage is. Is it coffee? Is it hot chocolate? Like, what is it that you guys like to have early in the morning when you need to start your day? If anybody wants to put that in, oh, I saw hot tea. I see some people from Arizona, Carolina, California, Texas, the UK. Somebody said coffee with exclamation marks. I'm so down for that because I need a lot of coffee myself. Um, and that's it. So that's great. Everyone's coming in. Coffee with creamer, I definitely agree. So welcome everybody to our last session of the day. I'm gonna move things along before we get started on some housekeeping rules. So I just wanted to go over a little bit of how the session is going to progress and just letting you know some key things that you would need to know during the session. All sessions will be recorded and they'll be made available at the end of the conference. We get questions all the time from people asking if it's going to be recorded. The answer is always yes. We want to make sure that you guys have all of the information after the conference ends, so it will be made available to you at the end. All attendees will receive a certificate of attendance for the entire TMF week. So if you attend one session, you're going to get the certificate of attendance and you can show it off on LinkedIn. People love to show things off on LinkedIn. You can brag and say like, look, I was at TMF week, the hottest online TMF conference in the world. So make sure that, be on the lookout for that. In terms of questions, this is an interactive session. It's a panel discussion. So when it comes to questions, it's not going to be at the end of the presentation because there really isn't any presentation, but you guys can ask questions throughout and we will go through it as the panel progresses. And when it comes to networking breaks, it will be after every presentation. However, for this one, this is the last session of the day, so there won't be a networking afterwards there. So you can come back tomorrow and network then. So that being said, I would like to hand over the mic over to Anusha Ramesh Babu from Moderna, Dr. Robin Farmer from Grail, and Jared Bruce-Lin from Intelia. So I'm handing it over to you guys. Looking forward to the discussion and have a great session. Bye.
Thank you. Thank you so much, Kim. So welcome, everyone. I'm really excited to be here to be talking about careers. So I'm going to start things off with some quick introductions. So I'll let Robin go first. If you want to introduce yourself, tell us a little bit about your name, your current role, and your company, and maybe a fun fact about yourself.
Sure. Hello, everyone. So happy to be here and talking about career. I think this is a rare talked about, topic in the TMF space. So super happy to be a part of this. My name is Robin Farmer. I am in the San Francisco Bay Area working with Grail. There I am their Senior Director of Records Management, Doc Control, Systems and Training. They all kind of go hand in hand, and maybe we'll talk a little bit about how that came to be and how the industry has evolved now that roles like this exist. And fun fact about me as it relates to the TMF, I really do enjoy organization of the TMF. I think a lot of times I've just had roles where you kind of come in and it's like, hey, our TMF needs some help just for starters, and got to get in there and get everything organized. And that's just something over the life of my career I have found that I really enjoy. So more about that later, I'm sure.
Thank you so much, Robin. Jared, you're up next.
Thank you. Jared Bruce-Lin, manager of the Trial Master File here at Intelia Therapeutics, based in Raleigh, Durham, North Carolina. although my company is fully based up in Cambridge, Massachusetts. Fun fact, prior to being in the ETMS sphere of influence, I was an educator of public schools here in North Carolina. Shout out to Westlake Middle School. I'm licensed principal in the state of North Carolina and Massachusetts, K through 12. So for me, the ability to stand in front of an audience of middle schoolers for which I taught and tell them things for which they have no idea what to do, nor do they care to learn about it, and do that 4 times a day, every day, really prepared me for the TMF world. So it's great. And I'll pass it back to you, Anusha.
Thank you, Jared. So my name is Anusha Ramesh Babu. I am a senior manager for TMF quality and oversight currently at Moderna. I've been in the TMF space for about 6 to 7 years. I started off my life in an archive digitizing old TMF records. So I'm really happy that right now to be where I am today. I am currently based in the San Francisco Bay Area as well, but my office is based in Cambridge. And a fun fact about me is that I am trilingual, so I can read, write, and speak in 3 languages. All right, so we'll jump right into all the fun stuff. The first topic or question I wanted to pose to you guys is to ask you about what brought you into TMF. So how did you get started, or how did you fall into TMF, so to speak? So Robin, if you want to share about your journey, that would be awesome. So what brought you to TMF?
Yeah, so I actually fell into TMF just kind of by chance. I was working at the time at Amgen, large company. I started there as a temp, as many people did. Amgen used to have actual temp agency on site, so they had quite a few temps. And I was doing contracts, and I had to be honest, I was straight out of college. I didn't really even know exactly what I was doing, what these contracts were, but this is back before electronic anything. So all contracts were routed manually. So I literally was running around campus all day getting signatures for contracts. And what that gave me the ability to do was to meet a lot of different teams and a lot of different departments. So I was running around with legal, and I would work with a lot of the administrators, making sure we would obtain these contracts. And then at the end of the day, I would send these contracts out to sites. So I got a pretty good understanding of just how clinical trials were working. I mean, very basic knowledge, but understanding. And one of the areas that was hiring at the time was the TMF department. And the reason being was that we were fully in paper. So you can imagine, Amgen's a very large company, the amount of studies that they were running at the time. And if you were doing that in times all the paper, we had file rooms that were, the size of offices that we were managing. So what as I came into that, what I found is it was a really good space to understand clinical trials, because as I was getting more into my career, it was like, okay, I understand this, because much like the contract signatures, still working with a lot of different teams and departments. And I think that's what kind of attracted me to it. It didn't seem siloed. It was like I had to work with clinical operations and regulatory. And these were all new groups to me at the time, but it was just a great place for learning. And before I knew it, 20 years have passed, and I'm still working in TMF.
That's how it always happens, right? You kind of just slip right in. But it's a great fit, and I'm so glad to hear about where you started your journey from. Jared, if you want to share a little bit about your journey, what was your path into TMF?
Very unique. So I had taught and did administration in North Carolina for about 12 years and moved away. And then when I moved back, there weren't any openings for positions in education because of the end of the school year. So I took a $19 an hour job in the basement archives at GSK, GlaxoSmithKline, where they had an agreement that they would ship all their paper TMFs and electronic ones, 100,000 banker boxes, from their warehouses to Novartis. So my role was to find these electronically, figure out where they're stored, go through them, ship them to Xerox to copy, ship them back to us, for which we'd go through again to make sure all the papers are there, everything's there, and then send it off to another storage facility for about a year and a half. And so I really got to understand the system, or how TMFs are set up and what they are, especially with the paper. And then that project was one of those where as soon as we finished it, they shuttered our department. So then I looked for another position within the bioscience, which kind of landed me in TMF and administration. And then from there, I found my pathway through as a TMF lead and to my present position. So yeah, I love it. I'm in Excel all the time, and
Yeah.
but yeah, it's that weird transition from public. And the best part is I can go to the restroom anytime I want and eat lunch for more than 20 minutes.
No hall pass needed. Yes.
No hall pass needed. It's great.
That's so awesome. I would love to hear in the chat, you know, what kind of unique role or weird place were you in before you jumped into TMF, or was TMF your beginning? So if folks want to, you know, interact and throw that into the chat, I'm happy to read off a few. But while I share my journey, it wasn't where I planned to be is where I'll start with 100% honesty. But I can't picture myself anywhere else now. So when I started off, I was just finishing up my master's. I had another semester left, and I was working in like a scheduling job. So I would schedule rooms for people. So that was sort of like my part-time job, because I went to school in the evening. And all I had in my plate was a degree that I was about to finish, which was in biomedical sciences. So it was in the pharma school at Northeastern. But I was also at the same time thinking, okay, I shouldn't be, you know, here for the whole time. I should try to look for other things. Obviously, many people that are from the Boston area know that Northeastern is known for its co-op program. So that was where I first started looking for roles. And all I could find was in lab clinical work. But that was not something that was interesting to me at the time. And that sort of puzzled all of my classmates, because most of them were coming to do preclinical research. That was their background. Somehow I started applying for jobs. I applied nonstop, I feel like, even in my sleep. And then I landed a role with a CRO at the time, working in an archive at the sponsor company. So it was like an FSP model situation. So I worked inside an archive, digitizing old TMF paperwork to turn it into an eTMF. So that's how I learned the reference model. I liked the idea that it was so organized and everything had its place. I think that's what kept me, you know, going forward. This is how I am at home too. Everything has a place. It has a home. So it made me feel very comfortable, and I felt like I fit right in. And here we are now, 7 years later. Now I get to QC and, you know, oversee a team that does TMF QC work, which has made my career truly come full circle. But I will say, even, you know, when I started in TMF, or like a true hardcore TMF role, the first time I came to the sponsor side, I still wasn't sure that it's where I wanted to be. And that actually leads me into my next question. I'm like teeing myself up here for the next question, which is, how do a lot of people see TMF as a stepping stone in their career, right? For some people, it's the other way around, where they are coming from different pathways, maybe from quality, clinical operations, or other places before they step into TMF. But a lot of people also see TMF as their starting point. So how has TMF, just like your first role, how did that open up other opportunities for you, or how did you see it? Because I think all three of us, we do different things today in our roles. So how did the first introduction that you got into TMF tee you up for your other adventures, or how do you think it could tee up the adventures for somebody that's looking into a starting career in TMF? I can take either Robin or Jared, whoever's ready.
I'll go ahead and start with that. So I think I'll take a little bit of a different approach on how I've kind of learned different aspects of the role that have, you know, led to other opportunities. So I mentioned, you know, starting at a pretty big pharma company, which I often call like Amgen University as far as my career is concerned, because there were so many opportunities to do different aspects of the role, right? We had so many studies. It was just such a large place. Like you could just be QCing all day, or you could be working directly with inspection readiness with the team, or whatever the case may be. And it was all very manual. I do think that really helped kind of develop my career over time because, if you think about electronic systems, of course, they've helped us so much in the industry. And, like I said, I started off with a file room that was as, big as offices I've worked in. And now, we're down to electronic trial master files, but still, I often say to my teams that anything that we used to do manually, you still have to think about it electronically. And so I think just over time, knowing some of those skills and having to do things in a manual way just seemed to have been stepping stones to the next path. So my next company I went to was a much smaller company, but I had, been pretty well versed in some of the larger tasks that, you need to do with the TMF and then just build with it. I do think that because we work so cross-functionally, sometimes there is kind of this notion that, this is a great place to start and then you can move elsewhere. But I've always found like I just wanted to stay with the TMF because I understood the importance of what the TMF is. I think during times of audit, everyone is your friend when it comes to the TMF because you are holding these documents. But I've always enjoyed just having that holistic view of the trial and being able to see and understand those components of it, and then just really staying in that area, and know that kind of knowing your audience, that you can still be helping other departments, other functional area groups, because you're the holder of those records. So I think just kind of that mindset has been something that's just helped me wanted to build on that and build a career through that.
I think it's great you were able to recognize that it was a crossroads for all functions. You learn a little bit from everybody, but this is like, the most about this area. So it's, there's so much more than just QCing documents. And it's cool to see that that's something that you've stuck with and you've recognized, throughout all your roles, throughout these last 20 years. Jared, if you want to share a little bit about your stepping stone moment, or, why you think this would be a stepping stone.
Yeah, so after GSK shuttered, I got a job at a big CRO for which I was a project associate. So I was the lowest rung on a ladder. My jobs were taking meeting minutes, creating agendas, doing calendar invites, anything administrative that the project teams needed fell on my lap. So I started to understand the dynamics of a study team, what goes into it, and what documents are needed. So from there, I worked my way through up to a promotion. And then I really enjoyed the TMF as I was in it, as I GSK. So then I made the leap to another CRO for which I was one of 25 TMF leads in an office, really understanding the TMF, being in there daily. And that just grew my understanding. And it's really just time commitment. And, I'd work hours off the clock just because there was so much work, so much to know, so much to do. And I think that really helped you. So really putting both feet forward, and you have to, and I understood that there's grunt work in the beginning, and it will be grunt work throughout your career, but getting those early belt where I could develop and understand relationships. So even now when I'm in the position I'm in, I understand what CTAs go through, where they have to create agendas for their study teams and get the minutes out on time. And what do you do when people aren't getting their updates to you? So, understanding those pressures really has helped in my career as I moved forward in this TMF area.
That's awesome. I want to go back to thank you for sharing. And I do want to go back to the chat because I see a lot of messages. But I think that we have some people that have shared their roles that they've had before. So I see we've seen some general retail roles and admin roles. Yes, definitely see a lot of that. And then handle all of the documents, being a program manager for a university research department. That's awesome. Started off not even knowing what TMF was. Same here. I had no clue when I started. And they were in the transportation industry for shipping and freight all over the world. And then we have some more admins. And then was looking out for TMF positions after being laid off in federal funding cuts. CTC, CRA approached about eTMF. That's one I see a lot. Folks in the CTC, CRA world coming into TMF. I've seen a lot of that recently as well. So that's really cool. In IT, that's awesome. And digitizing several million documents. No better way to learn 1572 FDF or CRF than by scanning a million pages. Agreed. So that is awesome. I think we all, at some point or another, we've all battled it out with a scanner somewhere and had to get staples stuck in it or something like that. So it's really cool to see that even though we all come from all these different backgrounds and, you know, there's a way in which we were able to apply those skills and bring it into TMF. Or doesn't always have to be that way. There's a lot of things that we also picked up along the way that have helped us develop our careers. So I think that actually ties neatly into our next topic, which is then versus now, the evolution of TMF. So from the paper world to digital, I think we touched upon this a little bit as we were talking through our other topics, is how do you think TMF roles have evolved? And I want to tack on a little bit more to it is how do you think it will evolve even further with the impact of AI and automation being part of it? We can't avoid it. It's become part of all of our lives now. ChatGPT is everywhere. So how are we, I guess, evolving as an industry? And, you know, how does the paper to eTMF evolution and how are some of those lessons going to help us now in this new era of, you know, AI and automation and bots, you know, in all of our systems? So I think this one will, Jared, we'll start off with you. Switching it up a little.
So, yeah, I mean, my hands were in a lot of paper TMFs. And, you know, for those coming into the industry, the terms of like storage, fireproofing, those are terms that people may not be familiar with. So I think it has fully evolved into this electronic. It's just much easier. Basic cost alone, not having to store things, everything's electronic. But AI, you know, I see positives to it, but they're still going to need this human element because as I spoke about earlier in my other presentation is that every study could have their own unique qualities. And I don't think AI is up to the task of knowing that for this particular study, monitoring visit reports, confirmation letters, follow-up letters, those may all get packaged together instead of individual sub-artifacts. So I think there are some nuances that while AI is great, I think if we become too dependent on it, it's going to be more of a headache as inspections come full circle.
Yeah. I think there's also an element of it provides you with as accurate of a response as you train it to. So there is still somebody that needs to train whatever model, or I will be the first to admit I am no AI tech expert. I'm just in my learning stages still. But from what I've seen, at least, to get the answer that you want, the knowledge that you're providing to it needs to be just as thorough. And in the TMF space, we've seen there is a lot of improvements that, of course, you know, folks in the systems world are trying to provide to us through AI. But there is also still some hesitation in accepting it, right? Because we still don't know what its capabilities could be and how it could be applied. But I'm sure there are, you know, lots of sessions and, you know, discussion forums where they talk about this at length, perhaps some even during our TMF week. So if you find any of those sessions, check it out.
And I would just add to AI, like from my background in education, everyone has different learning styles. And I think if we try and get everyone cookie cut to how AI learns, it doesn't, you know, hit everyone's learning and there will be people lost. So I think you still need that human element of understanding this person needs a more one-on-one. This person needs visual. I'm very big on, you know, providing visual step-by-step directions. So I think AI can't capture that or have the compassion that we do have for people as they learn how to file and what the TMF is.
Yeah,
for sure. Robin, I would love to hear your thoughts on this evolution.
Yeah, so before I go into that, I was just going to go back to our the last piece when we were seeing all the different spaces that people, that brought people to the TMF. I
Yeah.
think that's one of the unique pieces about working with TMF is that it really can be that type of role you fall into, coming from all different areas of the
Yeah.
industry. So I think that was really nice to see everyone's background there. But
Yeah.
yeah, definitely. So, coming from a space where, paper was it, and a lot of companies still have paper. Paper is always, when it comes to documents, paper is going to exist. I think there's very few places that are just fully electronic, but obviously we've moved away from paper, and I think that's been great. But what I've noticed, just thinking about the evolution and really seeing the evolution from paper to electronic, right? Like I say, there's still paper that exists and there's still processes that have to be manual. I think we're still
Mhm.
figuring out how ETMFs work and making those run smoothly, no matter which one you're using or what process you're using, right? I mean, if we see like the
Mhm.
mistakes that are happening, right, we still haven't gotten it right or gotten it to
Yeah.
a steady state. So AI is going to have to go through that same trajectory as well.
Yep.
Definitely agree with Jared. There's still going to have to be a human element, just like, you don't implement an ETMF and all your problems are solved. Like it only runs as well as the data that you put into it. It only runs as well as the processes that you apply to it. And AI
Mm.
is going to have the same kind of trajectory. So certainly, I think there's areas where it can help. I don't know that there's this thought that it's going to, manage everything. But even if that thought was there, I'd say it'd be a false one because
Yeah.
you're still going to need TMF teams. And then when it comes times for audits, anyone who's gone through this, I remember when going through audits with the ETMF was kind of a thing because that was new. We were used to
Mhm.
handing paper, and there's something so tangible about looking through a page and, oh, this belongs here, or give this or that. And certainly, yes, there's a lot more work around that with copies and things of that nature. But even with that, I think that every company is going to be different. Every department is going to do something a little bit differently. So you still
Yeah.
really still need to have that team that's going to have, again, that holistic approach,
Yeah.
understand, all the components to it, be able to relay that information, make sure your standard operating procedures, correctly display how you're using it.
Mhm.
There's, it's going to add a little bit of, I think, of more work before we really see the benefits of it.
Absolutely. It is a time intensive process, but one that I think will have great reward the more time we spend getting to where we want to be in terms of training and being comfortable with the tools that we use, whether it's through AI. But I do agree again. I think we all echo Jared's point that compassion and human compassion cannot be replaced through that. I see we have some questions, you guys. So I'm going to jump into the questions that we got in the chat before I continue with our, the rest of our topics, because I know we want to answer some of these. So we got a question saying, are there any free open sources or training platforms for beginners to get hands-on with TMF handlings and processes? I only know of one that I can think of at this time, but if either of you guys know of any of the platforms or trainings that folks can access for free, please feel free to share.
I believe Avoco is one, and
Yes.
CDisk perhaps is
Yeah.
another one.
Yeah.
And that's it that I'm aware of. I charge. No, I'm just kidding.
The next question we're going to get in the chat is going to be how much for TMF help.
$19.99, but if you order today, you get 1 month free. Shipping and handling.
I think that on top of that, see, this was one that came to mind for me. I think forums like this, where you can, make connections, and I think anytime I've done any of these types of events, I always end up with a couple more LinkedIn connections that lead to conversations. Which I think sometimes is kind of the best,
Yeah.
you can have, obviously, because TMF, a lot of it's so much about conversations, and every there's no two TMFs that seem to be created alike, no matter how much you think
And I don't know why that is.
I know.
Yes.
So, yeah, direct conversations do seem to be, great forums to be able to do that. But
Yeah. I know there is a lounge within the Montreal TMF week, and also there are networking breaks. So make a new friend, maybe become friends with them on LinkedIn. Also, I call it friends. I know it's connection. I think a lot of anxieties can be calmed by having a conversation. That's a good place to start. We're here to tell you, of course, like how our careers have been shaped, but we are only 3 people, and there are so many wonderful people in the industry, especially in TMF. Another big reason why I think a lot of people stay is the community aspect of it. It's events like this, and when we meet at conferences or just making connections through your work, everybody in TMF, for the most part, I feel, we're very inclusive as a community, so people feel well connected, and you can feel comfortable reaching out and asking someone, whether if you're local, grab a coffee, just whatever it feels like. It may feel awkward to just start the conversation, but everybody feels awkward starting these conversations, so just take some comfort knowing that.
And then once you start, you'll just talk in this language where my wife is like, what are you guys all talking about? Because she's attended conferences, and she's like, I don't understand what you're speaking. It's like her own Klingon, but we all know it, and eventually you'll learn it.
For sure. We have some more questions, and these are really, really exciting to answer. So I'm going to read them off. So the first one is, as TMF responsibilities evolve with increasing digital transformation and automation, how do you recommend that TMF professionals future-proof their careers? That is an excellent question. Anyone have an answer at the top of mind?
I think just having that fully understanding and knowing what you are able to bring to another person can outbeat technology. And just in the way that you describe it, your own experiences, this might be Skynet, but they still don't have that full human understanding of what you need specifically for your study. And I think documents that we create, I'm really big on creating, unofficial guidance for folks that I think will be better than what an AI could produce. I'm not concerned with that automation.
I think, on top of that as well is to evolve as well. There are opportunities to learn, to really kind of think of it more like records management than just the TMF, right? Like, let's be honest, records can tend to be a place where people just aren't that concerned or interested, right? And if you really can pick up an interest and come up with ways to help other departments with their documentations as well, because the TMF is more than just, we all know, it's more than just the clinical trial piece, right? There's many departments that feed into the TMF, but a lot of times their records management, however they're doing it, doesn't matter whether it's electronic, AI, paper, whatever the case may be, just the management of that and having it organized and, however, you're going to best want to present this in the sense of an audit or just however you want to organize your documentation or retain it, is all a part of that. And I think that really kind of honing in on that piece, kind of future proofs it, because if you really have a plan or an idea around, what the company should be doing around their documentation or see problems in other areas and offer suggestions on how to make them better, that really kind of expands the role outside of just, managing one piece of it, because really you want to see, if you get a good process there, you want to see that consistency across the board within the organization.
Absolutely.
And if you want your drug approved or whatever you're working on, TMF is really one of the main points. So if you do your homework, get it in and get it done correctly, filed away.
For sure. Thank you for sharing that. I think a personal anecdote for me on that question is that is definitely a question I've asked myself even earlier on in my career, maybe not as necessarily to do with digital transformation. But I think where I could share like the lesson that I learned is that I thought like I had, my blinders on, thinking that this is the only path down. This is all there is to TMF. And I think it goes back to what Robin, you had shared earlier, is that there's so much you can do with just the backbone of knowing, how TMF works. Is there's systems, there's quality, there's, within process and managing a business, managing a team. There's many avenues of TMF that folks can explore as part of, like understanding your own strengths. And it also touches on a point where if I did not have those conversations with people like Jared or Robin or others that I've come across in my career, looking up for mentors, mentorship, or just a buddy, a peer, to chat with him about my thoughts. They gave me ideas that then helped me think about, okay, this is another thing I could do. So find your tribe, like your people that will help you have those conversations, even though they're difficult and challenging. Or maybe they're just, you're walking into a lot of unknown and very uncertain times. It's a good conversation to have because maybe they can comfort you in a way that you probably didn't know you needed. So having that conversation, definitely helpful. I do see one more question, or there's actually probably a few more, but the one that I see now is, in your experience, what personal or professional mindset shifts were most critical in moving from a tactical TMF role to a strategic leadership position in records management? So anybody want to go first? I think we put the question up on the screen too.
Yeah, I see here.
Yeah.
Mine was really building those relationships with study team members, and then pieces fell into place after that. But understanding, what their needs are, the needs of the study teams, and again, I like to say, work smarter, not harder. What value can I add to make their work easier and make it more likely, that we have this drug that will get approved.
I think, kind of just piggybacking on what I was just talking about as ways to kind of expand the role. I think once I started looking outside of the box of just, I need to collect these records and the team needs to organize them, and really becoming like the steward of the system, right? Because you have more jurisdiction than you think, right? Like we may not need to be content experts, which I think is a misnomer because TMFers are very much content experts because we are looking at content. Yes, maybe we, aren't writing protocols, whatever the case may be. But once I started realizing, hey, we have more information here that's important, because in most of my career, we're preparing for, inspections and trying to get things approved or whatever the case may be. So as long as you're in that mode, really be the owner and, like I say, the informer of what's happening, and start getting that information. If there's problems or bottlenecks, explain that. If you're not getting what you need, there's teams or whatever that are lagging behind and not being timely. You think about Alcoa and all that. If they're not being timely with submissions, call that out. Really say that I'm trying to own this, because, at the end of the day, if there's issues with the TMF, though they may not come directly to the TMF team and say, why is this missing? That might be something for, the ClinOps team to really explain. If you see that, then, and really try to mitigate it, then I think that kind of takes you to a more strategic leadership type role, because you're really owning the content. And, if something needs to change about the system that you're working in, we need this functionality, or we need to add this, keep up with whatever platform you're using and know what type of changes need to be made to make things easier for the users. And once you start thinking strategically in those areas, I found that really has helped the role evolve into more than just collecting data.
That's incredible. Thank you for sharing that, both Jared and Robin. I'll share more, I guess, this I consider a personal and professional mindset, which for me is an everyday learning experience, is delegating. It is something I am not used to yet, because I've been in a contributor level role for a really long time, and me being in more of a was management, strategic leadership role. That's something that I'm still learning, and I feel like I will continue to learn over the years. I think being in this space, or just like having the personality type that I do, it's a learning experience overall for a lot of us, where we're used to doing steps A through Z and knowing everything all the way from start to finish. But now there comes a time when you sort of hand that off to someone else, and that comes with a level of trust, right? So that goes into the type of people that you bring on into your team, the type of people that you work with, and spending a little bit of time and energy in that training when you want to be delegating those tasks. So I think that's something that I feel I know I'm learning, and I'm getting better at it a little bit every day. But it is still not something I will be okay to admit it any day. It's still not something I'm 100% quite there yet. And maybe I will never be, but I'll be better every day as I keep trying to be more comfortable, delegating, and, knowing that it doesn't mean that the work isn't getting done or anything like that. It just means that at some point or another, we all face that shift in our career, from going from a contributor level role to a leadership level role, where you're not as involved in the day-to-day, in the weeds activities anymore. So you have to learn to pull yourself back, or else you're going to drive yourself into the sand.
Crazy.
So, and I think
I like
we have more
Kelly,
questions.
Katie's question about what kind of roles do you expect to grow into? I think that kind of goes with your, Anusha. For myself, I oversee a TMF department of one, but I'd love to be able to grow my own, where I currently am, into a larger department where I can manage people and provide that mentorship to someone who's coming into the industry, and kind of pass on what I learned and the ups and downs as well. So, I think really for TMF, sky's the limit. I mean, you could go into inspection readiness areas. You go records management that's outside the eTMF itself. So I think when I started, there really was just kind of a narrow pathway.
Absolutely.
And I really wish I had started after college instead of taking time to do what I did. But I think it's open, especially these days with so many bioscience and everything.
Yeah, I think, interestingly enough, when I started, so I was like, I don't remember exactly the role, but it was like records management 1 maybe, or, and then you could go up to be a 2 or a 3. And I remember thinking like, well, that's as high as it'll go. What more would I ever do maybe than managing? And now sitting in a more director type space, I don't think that, being pigeonholed to a specific function, I don't really think so. I think that I think records management has evolved more over time, right? It used to either be a standalone department or an extension of clinical operations. And I think now I've seen companies really kind of evolve with the time. So like I say, now that we know that TMF is not just the extension of clinical operations type of documentation, it's broader than that. The role expands more. So now I sit in a compliance organization and a regulatory organization, because that makes more sense for the business to have records management mandating, the work that we do within those type of circles, right? It's more of a compliance function. We want to make sure we're, good with the regulations, data integrity. And I have relations with that team, because what about the integrity of the data? Even just the role, trying to remember what the phrase is, the archivist of the company, right? A lot of times TMF people fall under that. So when you start, I work with legal as well, to make sure that our policies, because training has also fallen under our area too. There are so many ways it can expand. And I think now that's being just seen as a department within itself, the records overall. And that is probably a benefit of the electronic piece. I mean, paper before, if it meant owning all that, that probably was not as possible. Right. If you were literally, just talking about pages of documents to own for all these different areas. But with it being electronic, you can merge these systems. And a lot of times you would want to, do that, because TMF systems are pretty powerful and can handle more than just study data. So, should we just be keeping all proprietary data in our eTMF systems, under different type of, structures? It's certainly not a TMF structure, but could there be another structure where you could manage other types of data and then everything's in a validated system? So like I say, really kind of expanding that and thinking of ways to bring more things. I just think of different collections. Like the TMF can be a collection of clinical trial documents, but it could be other collections as well that we can own and still apply these processes to. And that really does help, not really pigeonhole the specific function. It's just evolved over time for myself, and I think it is for other TMF professionals as well.
Absolutely.
And none of us went to college for this, I'm sure.
Yeah.
Here we are. We're able to adapt and learn.
Mm-hmm.
For sure. I think there's more coming for sure. So I don't feel anybody should hopefully not feel pigeonholed that there isn't another path for you or there isn't something new that you can learn. It's certainly something that everybody thinks about when they start is this feels like a very niche role or a very niche skill. And I don't know if it'll go anywhere. That's certainly what I thought when I started. And I was like 6 months in, my manager at the time asked me, so what do you think? Are you going to stay? And I was like, I'm not leaving anywhere. You can't make me go now. I'm not going anywhere. So I think as it also comes with an element of you being passionate about what you do and taking initiative to, maybe you don't have that person at your company, or maybe you are that person at your company that seeks out resources or seeks out connections to grow your knowledge. So you will get as much out of this as you put into it, because obviously we can't all just sit and expect that everything will, be fine. So I think there is an element of that, like the work that you put into it is very rewarding. And I think all of us can certainly say that we've truly felt that reward in the roles that we play in our jobs now, as well as just throughout our lives, all the things that we've learned within this TMF space. I think we'll head to some of our, questions that we have, because I didn't see any more in the chat, but please keep adding your questions in. I think we still have some more time and we can answer. I'm going to jump a couple of topics ahead, just because I know that this one might take a little bit, is what would you tell your past self, walking into this TMF space, before you walked into this TMF space, reflecting on your journey? What advice would you give your past self coming into this role? And we'll start with Robin.
Oh, my past self. I'm just thinking about her. Her early days of TMF. Definitely, well, a few things, so Jared and I were talking about how no two TMFs are the same, right? I mean, I've been at enough companies to know the difference, and then have created enough friendships and colleagues who do the same things to hear about their experiences. I definitely would have, I remember not feeling like I understood it enough at first. I felt like there was so much to understand, and not really understanding all the components of it, and not even understanding what I needed to know, because everything was just flying at me at once, with different documentation and who's this department. And then, you almost have to, I think it's, great having longstanding careers at one space, but it is great to have opportunities at different companies to see the differences and then apply different knowledge, which I've been able to do over time. So definitely, realizing that TMF is it's ever evolving, which I think is actually what makes it exciting, because there's different areas that you can kind of mix and match and understand. Every company does it differently. There is no actual right way necessarily to do it. If you think about it, we are regulated by different regulations, and there's definitely standards you have to follow. But within that, it really is, whatever works best for the company, because obviously we're all doing different things. So I think having a very good base knowledge, is really what I have found over time that has helped me. But then also the flexibility to, work within the environment that I'm in as well. But, after having some pretty good successful inspections, under your belt, then you really realize, you kind of find out what you're doing, and understanding that piece of it. So I think just for me, it's just been that, enjoy the experiences, know that sometimes you're going to have to pivot and shift with that. But at the end of the day, if you want to have a really good base learning of, what the regulations are, you can really work within that.
Absolutely. Thank you for sharing that, Robin. Jared.
I'd echo the same sentiment that, that's why there's a food network, and that's why every pizza shop you go to, all the pizzas are different, but at the end of the day, it's the crust, cheese, the sauce, and the toppings. Those don't change. So our TMFs are all different. Even within our own, maybe a company, people are doing different things. And there are certain standards that you do meet. The crust, you have to have sauce, the cheese, whatever. You have to have that, the plans, certain documents filed in a certain area within the eTMF or outside the eTMF. So I think if I told myself years ago, it won't always match with what other people are doing, but you can still share the same ideas. I think that would have helped alleviate some of that anxiety when you first start. Mm-hmm. Okay, I am doing it correctly. I might be doing a little different than that person, but at the end, my pizza, my TMF will look like theirs. Probably tastes a little better. But,
That's
and
awesome.
Anusha, what about yourself?
Thank you. I think for me, this goes back even before I started stumbled into, I should say, into the TMF world, is that don't be afraid to ask the question. Even if you're the only person in the room that raises their hand. If you're shy or you're nervous, there's probably 10 other people in that room of 100 people that are having that same thought or thinking about the same question. And don't be afraid to ask that question. I think I later on realized that, and that's really what helped me, I think, move further, speaking up and learning to ask the questions, even if the answer is just very obvious and simple and right in front of you. Maybe that's not your train of thought and you haven't gotten there yet. So don't feel like you should just stay silent because no one else is talking. And don't be afraid to ask those questions. I did have a manager tell me once that I'm that person that always asks those questions, and he appreciated it because I asked those questions. Because then, if no one asks it, probably everyone's going to do it wrong. So it's a good thing somebody asked the question before we went forward. So just wanted to share that as just some self-reflection over the years. I wish I had asked more questions when I was still in college. I'm going to take a look in the chat to see if we have any other questions. I think somebody did share something that I want to read here. Is that in order to become a best all-rounder in TMF, like a lead or a specialist, one should know the core theory and technicalities of the system that they're working in. Additional to this, may I seek your insights on how one can learn about different department items, like, how does the TMF and local regulations, etc. I think there are some free resources that you can read up on. One that I know of, that there is a certification that a lot of people do in the clinical operations space. It's the CCRP. A lot of people do take that to learn more about in-depth regulations, but I believe that's US only. But there are a lot of resources that you can search and find online to go to. For some reason, I'm spacing out on all of the nice ones, but if anyone else in the chat actually has some ideas, if they wanted to answer Kasi's question, that would be great. Somehow all the links are leaving my mind right now. So if anyone has any, please share them with Kasi. But I know there's a ton of information out there. Lots of things that you can also learn still from TMF Week and attending other virtual events, conferences, or just, online research.
There's a book that I had used from, it's on Amazon, J. Rick Turner, PhD, A Concise Guide to Clinical Trials. And it really walks you through all the stages of clinical trials, phase 1 to phase 4. And a lot of the documents that you'll encounter with the TMF is spoken in the milestones or timelines when those documents would be collected and the reasons those would be collected. So I would recommend, that's a book I actually had read years ago when I started, because I really wanted to get a handle on the overall understanding of the different departments and how they contribute to my job and what I needed from them for me to be successful. So a concise guide to clinical trials.
Yeah, and just to add on to that, if you're, I know this is kind of talking about research you could do on your own, but I'm just going to take it a little bit internally when you're in a company. I always think it's smart for the TMF group to do a little bit of a roadshow with
Absolutely.
areas that you're going to be working with or areas that you need to maybe work with that maybe weren't contributing to the TMF but need to. And I think it's always great to have your established processes and procedure and then go to other departments and say, I want to meet with you once a quarter. Or, if it's
Mhm.
a group that you need to meet with a little bit more often, maybe, every other week or whatever, or be a part of their meetings as well and say, I know there may not be TMF information here or a very small part of it, but I want to understand what's going on with this trial. And, I want to get this information. So, TMF belongs in these spaces. And I think that, again, if we think back to just early days of the file room, was kind of like, yeah, the TMF people just sit in this windowless room, and then we go down there once a month and throw them a pile of documents, and then they tell us something was wrong, and we have to be out of that mindset, right? So definitely just making, and a lot of times what you'll learn, especially if you're using a system, is that a lot of teams don't have a lot of a broad knowledge of it. So if you go in and say, did you know you could look at this, or do you know that this also works this way, or we have these meetings? So getting ourselves out there, I think, has always been great, even if you're just a party of one or if you have a small team, whatever the case may be. To make those introductions and put yourself in places within the organization is also very helpful.
That's wonderful, because I've worked at two other small CRO, no, sponsors actually, where I reported to the vice president of clinical operation, and the person had no idea what I did, didn't understand. And you'll find that as you enter into this, a lot of people at the higher levels, they've heard of it, but they don't know how it works. So I agree with you, Robin. Go on road shows, ask different departments if you can present 20 minutes, 30 minutes. Just explain even the fundamentals of a TMF and the importance. I think that will go a long way, and it'll get your name and your department out there for people to say, oh, yeah, they do more than just sit in a windowless room.
Yes.
Absolutely. I think it is great to see that. And also, like, when you go to study team meetings and make a presence there as well, if that is your responsibility and your function allows for that, I think you learn a lot by just listening in on those meetings. And whether it's study kickoffs or what it may be, that's how I picked up a lot of things here and there, from other departmental knowledge, because I started and truly just stayed in TMF. I didn't go anywhere else. So just listening in, curiosity really helps there. I think we're ending, but yeah, Kim, we'll turn it back to you.
I just popped in. Like the conversation was so amazing. Like everyone is really engaged and putting in their what they're thinking. Great questions. I really didn't want to break it up. I thought this was going very smoothly, but I know we're coming towards the end of the session. I don't know if you guys can pop by maybe tomorrow in the lounge and maybe chat with some people later on, or if not, you guys can reach out to either Robin, Anusha, Jared on LinkedIn.
Absolutely.
Able to reach out to you. And I also shared Jared's recommendation, the book on Amazon, A Concise Guide to Clinical Trials. It's in the chat. So if you guys want to take a look at that, then please do.
I get no commission from it. I'm just passing it along.
Good to know.
Yep.
Good to know.
Sure.
So this was a great panel. Thank you so much, Jared, Robin, and Anusha. I think there's a lot of food for thought. People are going to take these golden nuggets and run with it. I hope they run. And I just wanted to say thank you for taking the time to have this conversation, because I think it's a very important one. And I loved a lot of your insights when it came to it. I just wanted to give a shout out for tomorrow. We're starting TMF standards. that's going to be our theme of the day. And the next session will be at 9 a.m. And we're going to be meeting with Nick and Dave and it's going to be beyond the PDF, the digital convergence of DDF and TMF. So please tune in tomorrow. We're also really launching TMF week, and there's a little bit of surprises or announcements that will be made by our CEO. So please check into that. And with that, I want to wish everybody a great afternoon. Could be morning, could be evening, could be in the middle of the night. I don't know. But I just want to say thank you so much for tuning in to our first day of TMF week. And thank you, panel, Jared, for helping out with that.
Thank you for the opportunity.
Thank you.
Have a good
Thank you.
week.
Have a good day. Good week. Bye.
Bye.